Hey everybody, a quick note about our precision medicine training program. It's been a really popular course. We're constantly hiring health coaches and physicians, but we're only hiring them as we grow if they're trained in precision medicine. You don't get that in medical school or other places. And so we've developed this training program and we've completely revamped it recently. It's a lot more robust. So now there's still over 50 hours of live synchronous training. There's also all the asynchronous credit, over 50 hours of content. And as a physician, you get about 50 hours of AMA Category 1 CME credit, which is a nice benefit. For the health coaches going through the training program, it's now accredited by the National Board of Health and Wellness Coaching. So graduates are going to meet the requirement to sit for the board exam and become board certified health coaches. So there's a lot of benefits to that, not just the certification, but also when it comes to things like insurance reimbursement. So it's a really robust program. If you're a physician, a nurse practitioner, a PA, or someone that just wants to be a health coach, it's open to all of those categories. There's the 6-month program that's kind of the full program. And then we also have just a fundamentals of precision medicine course, which is completely on your own. It's online. It's all asynchronous. You still get the 50 hours of AMA Category 1, but it's self-paced. And you still have access to the online community, but not all the synchronous lectures as well. So if you're interested in checking that out, go to wildhealth.com/education. And we'd love to have you as part of our next class.
All right. Welcome back to the Wild Health Podcast. Mike Stone here, and super excited to get to spend yet another, half an hour, 45 minutes with my good friend and health coach, Trey Tackett. Trey, I think we see each other all day anyway, taking care of patients. So what a fun break to just be the two of us.
Yeah. No, this is always the easy versions whenever we just get to chat and talk about, life and learning and all that fun stuff.
Yeah. I'm stoked. Let's just get right into it. So, we thought it was overdue to have an episode that kind of dug into the precision medicine training program that we have here at Wild Health. You've probably heard either, intros or outros on the podcast talking about it. But to get some real background on why we started a training program for precision medicine, who it's really for, what it offers, why would you do this? Why would you consider doing this? And sort of give some insight into kind of what's going on the back end continuously for the last almost 4 years at Wild Health. So I'll take the first one and just say, why? Why was this started? So, if you're a listener, you know that we're dedicated to precision medicine. We're dedicated to personalized care for individual patients and not population-based care. And that's a different model, right? That's not a model that you're going to find most of the time through your regular primary care provider. We also have a really deep dedication to team-based care model that incorporates health coaching and physicians. And I think that's also a very different model. Certainly starting to see things like that pop up, but by no means standard these days. And early on, Matt and Mike, the company's co-founders, really recognized that if we're going to bring personalized precision medicine in a team-based care model to thousands of patients, we need more people who know how to practice this way. So it's really that simple. It was, how do we get this program out to people so that you understand how to practice personalized or precision medicine? And, almost 4 years later, fast forward, we've trained hundreds of physicians and health coaches, and the program itself has evolved into a somewhat informal, non-accredited fellowship into a fellowship accredited for over 50 hours of AMA Category 1 continuing medical education, and as a full National Board of Health and Wellness Coaching accredited training program for coaches. So Trey, any thoughts or perspective on sort of what's happened to the program over time? You like me were kind of in on the ground floor when this first started, but would love sort of a trip down memory lane and some key highlights along the way, and then we can move into kind of what the program looks like today.
Well, I think first of all, Matt and Mike realized that they didn't want to have to train each person one-on-one like they did for me whenever we were getting started. They were like,
ditto.
They're like this. Yeah. They're like, this takes a lot of effort. I remember going through different genomic programs, and Matt Matt was signing up for accounts where he was like, okay, Trey, when I sign up for this account, they're going to, make you do a training. You're going to complete the training so you understand all of this from a genetic, lifestyle, precision medicine standpoint. And then I would ask him 1,000 questions. And then, it came to be that we developed the full training program. And honestly, early on, I think it was out of necessity because what we were doing wasn't unheard of. There are people out there doing similar, precision medicine, personalized medicine. But incorporating genomics, I know you were just on a paper that came out, Mike, if you want to touch on that a little bit, I think that's really cool. But incorporating genomics and physician-led genomic recommendations with health coaching was unique, right? I don't know that there was another company before Wild Health doing that. And so you would find providers that had been providing genomic-based care without health coaches, or you would find a coach that had been doing it with a Found My Fitness report from Rhonda Patrick, right? But they never interacted with a medical model or physicians. And so finding that kind of needle in a haystack of someone with the experience that we wanted to use to scale, it was really hard. And so whenever we were able to build the educational program, not only did we find like-minded individuals, but we had the opportunity to train people to do this type of medicine in a collaborative model. So that made hiring and training easier, but also too, we just really wanted to spread the word. And we've, at Wild Health, since its inception, been really focused on community. And this has been a really nice community transition for me coming from traditional medicine, right? Like for those that have worked in an ER or been a nurse, like you have really tight bonds with the people that you work with, kind of going through fire together. But it's in a pretty crappy situation. Whereas I felt like in this medical community, it's been an uplifting situation where you were able to form bonds and lean on each other to learn more, as opposed to just picking each other up off the floor. So that's been a nice change too. And I think a lot of people appreciate that when they come into the program.
Yeah. I mean, I think back on the folks who've come through the program and sort of what's led them there. And it's really a shared vision for the belief that healthcare can be better, and that we can really, some of this is cliched, but it's incredibly true, right? You can meet a patient where they are. You can work with them to figure out what's most important to them. You can take a step-by-step approach to improving their health, hitting their specific goals, finding out why they want, what's their motivation, what's their inspiration, and how do you take them from inspiration and motivation to accountability and habit and passion, and get people really excited about their health instead of going, oh man, yeah, I got to go see the doctor because I haven't been taking my blood pressure medicine and they're going to tell me that it's still bad. And, it turns into this super, so often in traditional healthcare, it's just this super negative interaction. Doctors are pressured. They've got, malaligned incentives and, documentation requirements, and don't have enough time to really sit with a patient. And a lot of the folks who've come to us, and just maybe worth a quick pause, like who comes and does this kind of program, it's a huge range. I mean, we've had pediatricians, nurse practitioners, emergency physicians, for fitness coaches, personal trainers, folks who've already worked as a general health coach, family medicine practitioners, sports medicine docs, flight attendants, dentists, pilots, teachers, like, humans who really just think that there's got to be a better way. And, jumping ahead a little bit, maybe just to kind of bookend, like what do people do when they're done with the training program? Number one, they've created a real community and a real tribe of similar like-minded people, which you already kind of hinted at. And I think that's a real surprise benefit for a lot of the folks who come through, just how tight-knit this group can get. And then, some folks take precision medicine back to their medical practices. Obviously, like, the fellowship is, or the training program, now we call it the training program, is, sort of a soft roll 6-month interview for us. So as we scale and bring on new doctors and health coaches, it's really a wonderful opportunity to know that they're coming through a training program that we approve of and have developed, and we've gotten to know them over the years. So it's a great hiring pipeline for us. And then some folks just take this knowledge and apply it into their own lives and to the lives of their family members and their friends. So it's been really, it's been a labor of love for sure, but it's been so incredible to see what people have done with it. So, maybe let's pivot a little bit into, I think one of the most exciting things we've done with the training program over the last 18 months, which is moved it from a program that would really get people motivated about health coaching and knowing the basics to trained up to the point where they are ready to sit for the National Board of Health and Wellness Coaching certification exam after completing the training program. So maybe Trey, just, quick highlight on the importance of coaching and like how we tailor the training program to the NBHWC, because I can't say National Board of Health and Wellness Coaching over and over again, topics and why that's useful.
On that note, I had one thing I wanted to say before we move into this, and it pertains to what you're talking about here. So, as people come into the program, initial interviews or folks that are interested that want to chat with you and I before joining, they'll often say like, what am I going to do with this when I'm done? Or I don't have a background in nursing. And, some of that is helpful, having a medical background, so that the new information is not overwhelming or not, shocking at first. But there have been really successful cases where folks have come in, they're an engineer that are looking for a, career change. And maybe they want to start out as a health coach, or maybe they want to, see what this training's about and then potentially go on and get a medical doctor, right? Like there's been a lot of cases where this is the entry point for people. But I think to the point of health coaching, I think that's a really broad entry point for people who are interested in health and wellness and in a way that they want to have a holistic impact. So while the thinking for most of these people is that, perhaps they want to go and be a personal trainer and just train people for exercise. But whenever they've started doing that, they became a personal trainer, they felt limited in their ability to give nutritional advice, or the folks that were coming to them weren't recovering appropriately. Maybe they weren't sleeping. And then as they kind of start to understand how all these systems are interconnected, they realize, okay, I would like more knowledge in all of these areas. And I'd want to be able to help people with motivation, with coaching, with data, really be able to execute from a 360 perspective on improving their health and wellness. So, the National Board of Health and Wellness Coaching Program is an accredited program. You become certified as a health coach. You have to pass boards afterwards. It's very similar if you've completed any other medical training. You go through a program, you have a number of hours you have to meet. You have a, clinical checkoff. It's called a practical skills assessment and coaching. And at the end, you have to get a certain number of hours clinically and then set for boards. Once you do that, you're an accredited health coach. And that's where the majority of coaching companies or companies employing coaches are looking to hire, is from that accredited field. Some exciting developments, potentially having that be billable.
Amazing. So, if I were, and probably a point of clarification, like we have folks who come through the training program who want to sit for get prepared to sit for the board exam. We also have some folks who come through who are already nurse practitioners, physicians who want to be able to sit for the exam as well, just to add coaching, a recognized health coaching certification to their resume and their skill set. Walk me through sort of what we've always combined the physician, the provider, so physician, allied practice providers, and aspiring or current health coaches. We've combined it into one cohort, and that really goes back to our commitment to working together as a care team. I think it's really important that I understand what the health coaches do, that the health coaches understand what the physicians do, and how to communicate together and speak the same language. So we still do that. So walk us through what the program details look like in terms of getting through the requirements to sit for the NBHWC exam. Now, before I'm asking you a question and then I'm cutting you off before you get a chance to answer, which is, the curriculum itself is tailored both to physicians and to coaches. So even if you wanted to go through the program and not sit for the exam, there's weekly meetings, there's asynchronous videos and lectures and text and references and primary literature to kind of teach you the core medical concepts. But let's say I wanted to go for the full Monty and learn how to really be a health coach. What other aspects of the program really train me up for that?
Yeah. So as you mentioned, we find it very important, and it's the most unique part of our program is that health coaches get the, extensive medical training. They learn alongside the physicians, and they also are involved in the discussions around case studies and the live reviews. So they're able to hear those medical questions be asked and answered, and the group kind of come together and create ideas around that. But from just a pure coaching perspective, you're going to get that information. You're going to get that education. You are still required and need to become a sufficiently good health coach, learn all of the different coaching modalities and skills, right? So if you lay it out in a way that the national board does, you would be looking at coaching structure first, which is essentially the structure of a coaching call or a coach client interaction, right? So understanding what an early visit would look like, what intake looks like for a health coach, what you're doing in those early sessions around discovery, whether you're establishing rapport or you're kind of setting vision for that client where they potentially either need to discover or you need to have a conversation around what their overall long-term vision is. And then you start to really dive in on those later calls where you're establishing goals, be it SMART goals or short-term, long-term goals, and then finding ways for them to execute on those goals. From there on, if you move like systematically, you have coaching process, and that's where the like kind of soft skills come in. People automatically think of coaching and motivational interviewing, right? So there's a lot more to that as far as what you're actually doing in a call to produce positive results. I think if you've never been exposed to coaching, this is probably the hardest part to grasp, because I could sit here and read like the list, right? Like you could say client-centered relationship, or you could say building trust and rapport, active listening, or powerful questions. All those things are legitimately important, but if you just hear the words and don't really see them in practice, or when the skill should be used based on kind of the interaction and the intuition of the coach, it can become pretty difficult to use in actual practice. So the curriculum covers that in kind of, lecture setting, but we also encourage you and give you homework with your peers to practice these skills. So, from the beginning of the program, we're going to go ahead and recommend that you pair up with another student and you start practicing the skills that we're teaching in the lecture. That's not required, but it is a really important part of becoming a good coach. You go through the entire, program. There's other sections that are required, like health and wellness, and then ethics and legal as an important part to finish out that like core competency section. You have 24 weeks of lecture. Those are 2 hours a week. And then in order to pass or graduate, on top of the lecture attendance, you have to complete 2 practice coaching calls with feedback from one of our faculty following that call. And the grading for that practice coaching call is based on the criteria that I'm discussing here, using the appropriate skills, setting appropriate goals, communicating effectively, practicing active listening, and so forth. And then your third practice coaching call is actually called the practical skills assessment, which I mentioned earlier. And that one's for a final grade, pass or fail. If you do fail that one, you can take it again. It's not a big deal. We're going to give you feedback. We're going to get you kind of some study material, get you corrected, and give you another chance to do that call. So once you've completed your practical skills assessment, that's whenever it really kind of kicks into high gear for you getting clinical experience and practical application. You start with a list of clients. We can help you identify some, but generally people are looking for acquaintances, friends of friends, to accomplish 50 coaching calls, which have to be logged and then given to the national board whenever you're ready to apply for your board test. All that being said, the finding of clients can be a little bit intimidating sometimes. So we've helped a lot with that. I know Bailey and some of our administrative staff have come up with some really effective marketing tools. But this is something I wanted to bring up too in general, is whenever you're practicing coaching or considering coaching, it's actually way more effective to do it with an acquaintance or a friend of a friend than it is a family member. Some of these topics can be a little bit sensitive. And a lot of times, you're not you're not crossing into the therapy range ever, and you shouldn't. If you feel like someone needs therapy, you should be referring, but you're going to be talking about topics similar to what a person would bring up with their therapist, right? There could be sensitive topics like, I'm really dissatisfied with my sex life, and how am I going to go about talking about this with my partner, right? So that's not something that you generally want to approach with your best friend or your aunt or uncle or something like that.
Yeah, don't coach your spouse and ask about what's going on with your marital life. It's a good call.
Yeah. That one's as obvious as possible. But in general, I think these difficult conversations are an area that providers and health coaches alike, I don't want to say have shied away from in the past, but I've been to a lot of general practitioners for myself, for my kids, and those difficult topics you don't really have time to cover. And from a health coaching perspective, you do have time. There's a problem with scarcity in the medical model of physicians not being, there's not enough of them. And so we're not trying to extend our physicians. We're trying to provide additional care, and our physicians have a much better panel ratio than other practices. And I think that's the way forward in healthcare. But having someone there for accountability and for discussion when you need it is really important to have a health coach.
Yeah, I'm reflecting on a call we were on with a client. And obviously, we won't share any specific details, but Trey and I were on a call with a client who basically raised a question of whether we might be the appropriate people. Would it be appropriate to share any concerns around emotional mindset or spiritual mindset? And we both just, started smiling, laughing, talking over each other because we were so eager to get into that conversation. But, it is... I think part of the issue is just my opinion, man. But part of the issue is this is, you go see your primary care physician and maybe you're not doing so well from a mental health or emotional standpoint. And there's this assumption, I think, in traditional Western medicine that, well, that's something for a therapist or a psychologist, psychiatrist to deal with. And that doesn't have to do with your actual health. Your physical health, and obviously having a more integrative approach. I mean, I love the fact that I get to spend, 30 to 60 minutes at a time with each patient, and that all that stuff's on the table. Right. And I think being able to handle those difficult conversations, know how to get into them a little bit deeper, knowing when it's time to refer out, knowing when it's time to just readdress and provide some support. That's more emphasis for why friend of a friend, acquaintance, good partner for this kind of stuff, but maybe not somebody who's super close. It can be a little sticky. I think coach family, from
the perspective of of the material that you're learning here, I think too, if I look back on myself as a clinician when I was graduating as a nurse practitioner and going out into the workforce, if someone came to me as a new grad MP and they had, I don't know, a psychological disturbance that wasn't suicidal ideation, wasn't depressive, wasn't anxious, but here I am as a GP, wasn't, generalized anxiety disorder, I should say. And here I am as a GP. I'm like, do you just want me to prescribe something? What do you want? I have 15 minutes. And I felt very defensive of that. I didn't really know how to help them address it. I didn't know any of the modalities that may help them from a lifestyle perspective, whether it was breath work or meditations or just being able to have a discussion with them about, kind of root cause, where it's coming from, what they want to do to change the problem that's eliciting this feeling for them. And, going through the training and writing the training myself, it is comforting to know that I have tools in my arsenal to have this discussion with this person. And I've seen you have the same discussion as well, Mike, where, you're not, you could, but you're not treating a psychological disorder as much as you are working with them to improve their mental health, even optimize their mental health. Right. And I think that is something that doesn't ever get addressed, in my opinion, in general, Western medicine.
Yeah, 100%. All right, we can go off on a tangent around emotional, spiritual health. We may just have, and that's okay. But let's. I'm gonna give you some rapid fire questions, Trey, and I'm definitely blaming your fuzzy appearance on the screen on your internet connection, and obviously can't be mine. But we're recording locally, so I think it's going to turn out fine for the listeners. You and I might have a little choppiness along the way. All right, so I'm going to ask and answer the first question, which is, who's this program for? Because we kind of talked about it already. It's really for physicians or healthcare practitioners who are interested in learning the fundamentals of practicing genomics-based precision medicine. So you'll learn everything from specific single nucleotide polymorphisms to how to address chronic diseases like insulin resistance, hypertension, hypercholesterolemia. You'll actually understand lipids after doing this program, which was something that I was grateful for. And then, everything from supplements to sauna to cold exposure to how to design exercise programming to recovery, all the fundamentals of health coaching, like we've talked about. So, really physicians, healthcare practitioners, or anyone who's thinking about going into a health related field or health coaching opportunity who wants to take this integrative, progressive approach. So here's the rapid fire. Ready? What's the time? What do you tell people? Like, I'm interested in the program and I do or I don't want to do the coaching requirements to sit for the boards. What's the time commitment look like for me, like weekly? If say I don't want to bother with the live lectures and sit and the structured interviews and the grading, I just want to go to the weekly meetings and I want to do the asynchronous curriculum. And then what does it look like if I want to go all in?
Yeah. Well, I think I always start this by saying, for each person, the asynchronous training or the recorded lectures online are a little bit dependent on your learning style, right? How quickly you move through material, how long you want to stop to take notes and go back and rewatch. So, that's pretty variable as far as, time estimates go. I've gone through it multiple times. Of course, I feel more familiar now, but I think, generally speaking, you could get through and have a decent understanding, get about 2 hours a week there, maybe a little bit longer. Now that we've condensed it, actually, Mike, I think it'd probably be more like 4. But put that to the side. You're going to have, your general asynchronous recordings there. For coaching, you do have time requirements that are scheduled, right? So these have to be synchronous. You have to be on with faculty, and there is an attendance requirement, and you can't catch up, right? So like, I'll go back and fix that statement a little bit. But in the asynchronous version, you could watch 3 weeks worth on week 3. You could get started late. You could catch up. They're there, right? And as long as you can complete the program, you're going to get the, AMA certificate there as far as getting your continuing education. For coaching, though, it's required that you're there. We have to take attendance, and those occur twice weekly, right? So we have one in the evening on Eastern time. Right now it's scheduled for Tuesday evening, 6 to 8. Then we have one Eastern time, noon to 2. So all time zones should be able to technically find a slot that's not during significant working hours for the majority of the U.S. population. So there's 24 weeks of that. You have to attend one or the other, Tuesday or Wednesday. So you're going to have about 2 hours per week that you need to be on live. And then there's a Thursday webinar for all parties to join. And that's for both just the medical doctor track. It could be a nurse practitioner, anyone that's not interested in doing the National Board of Health and Wellness Coaching certification, but also those doing the National Board of Health and Wellness Coaching certification join on Thursdays. So you have 3 hours per week for coaches. And then when it's time to do your practical skills assessment, you're going to have a call that you record under 30 minutes. And then you're going to have 30 minutes of feedback, and you have to do 3 of those during the duration of the 24-week program. So all in all, right around 3 hours per week that you need to commit for coaching alone. And then you have an hour 3 times in the 6-month period.
Fantastic. And, I also think that there's a wide range in how much time you can spend on the asynchronous curriculum. So I usually tell people, budget 4 hours, but if you really get deep in and you want to go look at some of the primary literature that we reference, and you want to listen to an additional podcast that we might reference in the curriculum, you could easily spend 20 hours a week if this was what your main focus, diving into it. There's, it's sort of, again, I'm super cliche today, but, like medicine is lifelong learning, and I still research stuff and learn stuff. And I've helped develop the curriculum for the training program and been faculty for 3.5 years. And I do precision medicine, and I'm still learning and learning and learning. So, I think 4 hours is the short answer, but, go for it. If you want to spend more time, it'll just make you have a more complete understanding of what's happening. All right. Rapid fire number 2. I'm interested in this program and I don't have any medical background. Let's say I'm coming to this from a background in, I don't really want to say it like that. Fitness coaches do have a medical background, so I'm not going to include them. Let's say, let me say I'm a former flight attendant, and I want to get into healthcare, and I'm not ready to pull the trigger on going to medical school or PA or nursing school. So what if I don't understand any of the medical jargon? Am I going to be able to get any of this? Is this going to help me?
Well, if you're a flight attendant and you're already listening to this and you are interested in medicine enough to have found this podcast, then you're probably pretty well aware of medical jargon, more than you think. All of us have imposter syndrome at one point or another. And the real important part of this is that knowing you're coming in maybe a little bit fresh or green, that's okay. You're really going to be supported. And actually, we've had this quite often and have looked to address this through various lectures, right? So we have, medical terminology for coaches included, where you have, a learning program that gives you kind of breakdowns of anatomy, right? So you're just not getting stuck out there from like a blank slate, right? You have some building blocks that we're providing along the way. And then you have all kinds of opportunities to talk with us as faculty. You have opportunities to talk with other coaches and other medical providers to ask questions like, hey, should I be spending this much time learning this part? And we're like, yeah, no, probably not, right? That anatomy of the ear is not going to be that important for you as a health coach. You don't need to memorize all those little bones.
Yeah. And I think a quick follow-up rapid fire is why does it matter to understand genomics and functional interventions as a health coach? And I might steal the answer a little bit here too, just to answer your earlier reference of, we literally just had a paper accepted for publication in a peer-reviewed journal looking at physician-led care team approach, including health coaching, to reverse some of the biomarkers of chronic disease in the patients that we care for. And if the coach doesn't know what the doctor is talking about, and the doctor doesn't know what the coach is talking about, that's not really much of a care team. So I think pretty self-explanatory, but anything to add in there and give us some more perspective from your side?
Yeah, I think from a learner's perspective here, I think a lot of people that are interested in what we're doing don't want to be boxed into a standardized coaching model, right? They want to have this precision medicine knowledge. They want to be able to point people in the right direction of, high quality resources and understand those resources, articles, whatever it may be, and have conversations about those, right? So, high level discussion on genetics, right? Or somebody comes to you and they're like, I heard that I have this MTHFR gene mutation 10 years ago, and now I can't do X, Y, or Z, and that's why I'm broken. And it's like, let's look at the literature together and let's understand, how impactful this may be. Let's look at your entire polygenomic risk around methylation and understand what your folate metabolism is so that the patient is empowered, but the coach isn't just taken aback by like, oh, some doctor told me this 10 years ago and now we can't do X, Y, or Z effectively, right? And then you box yourself into this understanding of, maybe somebody that you shouldn't trust. And I really feel proud that our coaches are empowered to understand genomics at that level, but also medicine in general. And then they can point folks to appropriate resources and articles.
Amazing. Yeah. Just to plug, I love our health coaches because that's like 9 out of 10 questions that I don't necessarily have to get involved with to answer appropriately. So thank you. Bless you for what you do, health coaches at Wild Health and elsewhere. Any questions for me, Trey?
Yeah. So I'm just curious, Mike, as far as you coming from the emergency room, being an emergency medicine trained physician, it seems like not only have you enjoyed this, but you've done really well. And I've seen a lot of other physicians really flourish coming from emergency medicine where they perhaps weren't super happy and moving into precision medicine. And I'm going to do what you did to me, where I may answer a little bit of this before you go. And I know that there's a part of this where we see so many people that could be fixed that we don't have the opportunity to help in that setting. And I know that's motivating for folks. I've heard that so many times. But the question I wanted you to answer was more, is that skill set really transferable here? And how do you see other types of medical providers?
Yeah, that's a great question. I think we've talked at length on the podcast, and you're referencing it here, the sort of, seeing downstream effects of the lack of really comprehensive and preventative, thoughtful care, and that is a motivator. I would say that the skill set is really transferable. Emergency physicians, family medicine physicians, primary care physicians, like all of those specialties really need to know a bit about everything, right? They're not cardiac electrophysiologists, right? And I love myself some cardiac electrophysiologists. They're great. If you're having a dysrhythmia and somebody needs to put a catheter into your heart and like burn the part of your heart responsible for your abnormal rhythm, I don't want to see an emergency physician or a family physician or a primary care doc. I want to see a cardiac EP. But we're asking people to really take a step back in the way that medicine's practiced, look at, sure, all of the standard preventative care measures like the U.S. Preventative Task Force, et cetera, but then to look at things like insulin resistance, cancer detection and prevention, managing cardiovascular risk at a young age, managing hyperglycemia and glycemic spikes at earlier in life to avoid insulin resistance and prediabetes and diabetes and those complications later in life. And folks in those specialties are used to learning new things. The science changes. They know a lot about different areas of medicine. So I think there is a certain amount of fit there with a more general practitioner who doesn't focus so tightly on one specific surgical subspecialty or medical subspecialty, where I've seen folks in all three of those areas, primary care, family medicine, emergency medicine, really easily transition here. Now, there are some harder transitions. Learning to ask good questions and learning to listen, because you don't have a 15-minute cutoff, or in the emergency department, a 2-minute cutoff, where you need to go and get called out of the room. You're not dealing with the frequent interruptions you get in emergency care. So like reconnecting with what an ideal for you bedside manner and patient interaction style looks like is an adjustment. It was an adjustment for me, for sure. An amazing one. I'm really so thrilled that I made this transition. And not to bash on emergency medicine, practice emergency medicine for 20 years. It's an incredibly hard and valuable job. I mean, it is the safety net of American healthcare, and kudos to everybody who's still working in the emergency department. But at some point, if it isn't resonating for you, and it's a tough job, and there's lots of opportunities to transition into other areas of medicine. Folks in family medicine, primary care, emergency care, we know how to adapt. So I do think it transfers in that sense.
That's a beautiful answer, Mike. Well put. Nailed it.
Boom.
Yeah, and I have to agree with a lot of that, right? The big take home for me there is like actually allowing yourself to recognize how much time you have and practicing from a place of abundance in a traditional, medical model of scarcity is just such a transition, and it's such a beautiful one when you fully engage with it and grasp it.
All right. Anything else on your mind, Trey?
No, thanks for having me on today.
All right. Well, I'm going to do something that. So my question for myself is, if I'm listening to this and I'm interested and I want to learn more, like what are 3 things I can actually take away, or maybe 4 things? So rapid fire questions to myself. 1, what are 3 things or 4 things I can take away? So number 1, like shameless plug, sign up, come learn precision medicine with us. It is a ton of fun. You will love it. We have cohorts that go through the training program every 6 months. So they start in either January or July. And it's October now that we're recording, so this will probably come out next month. So, certainly reach out. A lot of your questions could have been answered in this podcast, but if you need to get in touch with our team or with Trey or I or anybody else from the team to find out more and see if this is a good fit for you, there'll be a link in the show notes for the podcast to go ahead and get in touch. So always love meeting like-minded people and expanding our tribe in this sense. So feel free to get in touch and ask questions. I think if you really don't have a sense of what in the heck we're talking about, because maybe you're new to the Wild Health podcast and you're like, what is this, precision personalized medicine, early detection, preventative care of which you speak? I think Peter Attia, Outlive, the book, great book, great introduction for folks. And I think this has really become a kind of a gateway experience for folks who are going, I don't really like medicine as a patient or as a practitioner right now, and is there a better way? So definitely would go ahead and recommend that. And then listen to the podcast, the Wild Health podcast. We go through a ton of really amazing stuff, and just go ahead and listen to it and apply what you've learned to your life, or sign up and become a patient, or sign up a family member if you want, or just take the lessons that you learn and see if there are opportunities to apply them into your own life. So Trey, this was so fun just to hang out with you and chat about something we're both passionate about. We're not... it's 4 years, I don't know, 10 years. I don't know how long we're going to be running this training program, but until medicine's fixed, or we retire. So that's going to be a long time. And excited to be able to do it with you and the rest of the team. And we'll catch everybody on the flip side.
Yeah. See you guys around. Hit us up.
Thanks for listening to the Wild Health Podcast. If you found it helpful, give us a 5-star rating and write a review on iTunes. It really helps the podcast, and we greatly appreciate it. If you want to be a client or you want to work with us, go to wildhealth.com. Thanks again.